Hey there. Thanks for calling in. I'm Cameron Eldred. I am one of the athletic trainers through Franciscan Telemedicine. It looks here like I've got a little bit of information. So your name's Jordan, right?
Yeah, Jordan.
All right, perfect, Jordan. And it looks like you are 53, right?
Yep.
Okay. According to this, you're quite the athlete.
Yeah, I've had my experience with running. I've had a lot of success in high school. Brought me into the collegiate setting where I won quite a few national championships as a cross country runner. Loved it. I'm a head coach for cross country and assistant for track and field at a small D3 college in here down in Southern Florida, and really love running and just being competing. And I think there's more to life than just competing. I think I've learned a lot through running and all that. So I'd like to kind of give back and still keep myself in shape and pushing myself, pushing the limits. Always
Well,
push the limits.
hey, you know what? I'm impressed. You're getting, you're not getting younger and you're still pushing hard and you're doing a heck of a lot better than I do. So I am thoroughly impressed. Um, so it looks like, just in the history filled out, you were just recently competing in an Ironman.
Yeah, I did the full Ironman 140, and I went through the swim and I went through the bike. Okay, and then I was finishing up the marathon. I was in about the last half mile, and I don't know what happened, but somebody just left. Somehow they left their cup. I mean, they're not really supposed to do that. It's supposed to be in certain areas, but they left their cup right in the middle of the last half mile, and I wasn't paying attention. I was trying to push through, and it was there, and my left foot stepped on it. It slid forward, and I kind of like fell to the ground, and my knee went in, and I kind of felt like a pull in the back, but also more in the inside part of my knee, and it hurt a lot. It was like probably quick pain, but then it kind of I was too worried about finishing the race, and I just kind of like jogged through and really didn't finish where I wanted to finish. It really slowed me down that last half mile. It was a pretty significant decrease in my ability to run.
Oh man. Did you feel any previous knee pain during the swim or the bike portion?
No, I can't say I've had anything else really go on. I do really good. I think I've done a good job at maintaining my body. No aches and pains. I've had a couple muscle soreness things here and there, but it just do some muscle recovery, and but nothing really bothered me during the race.
Yeah. Have you ever had any previous injuries? Let's see here. You said it was on your left side. So
Hmm.
let's start on that side. Have you ever had any like lower limb injuries on that left side before?
No, I've never had anything really on that left side before.
What about the right side?
Um, Gosh, I gotta really think back. Um, Really can't think of anything that was really significant. I mean, I kind of sprained my ankle a few months ago on the right side, but I mean, it really wasn't anything. I just kind of took some time off and a couple weeks, and I was kind of back. I actually only took like a week off, I think, and was kind of back at it, and really never thought twice about it, and just went forward. Never gave me any issues.
Okay. Never saw a doctor or anything like that for it.
No, it wasn't significant. It was just I kind of tweaked it. Kind of never really saw anybody. I've been around the block enough that just kind of take some time off, and I'll get back out there.
Yeah, definitely a lot of self-help and self-healing.
Yeah, yeah.
Yeah, there's nothing wrong with that. When you know your body, you know your body, right?
Yeah, I'm 53 years old. I don't need to. I know I've been around the block and I've seen plenty of my athletes have ankle sprains. There's not much you can do for it, but let it kind of recover and get better. And
Yeah.
it wasn't big. I didn't really swell or had a little bit of bruising, but no pain really. And
Okay.
kind of went back to running with nothing. It was okay.
Okay. Um, so have you ever had like any upper extremity injuries that you can think of?
No, no upper extremity injuries.
Okay, perfect. Um, what about do you have a history of any illness or familial history of injury or illness?
Yeah, I actually am a type 1 diabetic. I've been a type 1 diabetic since I was a kid. It's just something I don't know. I've always had it. I've just, I don't know. I've always had it since a kid. And a few years ago, or a couple months ago, I had some stomach ulcers and whatnot. No problems. No cardiac or or no heart or no lung issues, no blood disorders. My grandpap had sickle cell anemia. He was diagnosed as a child with that, but I was tested in college and they never found any traits or anything like that. So I don't think I have any of that going on right now.
Okay.
Other than that, nothing really sticking out that I can really think of in my family that would give me any concern.
Okay. Um, and then you said, I just want to make sure you said with yourself, you've never had any significant health issues
I have type 1 diabetes. I was
other than type
diagnosed.
1 diabetes. Yeah.
Yeah,
Sorry.
I had type 1 diabetes. I was diagnosed like that as a child,
Yeah.
and I had some stomach ulcers a few months ago, but
Yeah.
kind of just went through it, and doc helped me take care of that, and no problems now.
Okay. So when exactly did this injury occur to your left knee?
This happened. I finished last week. Like I said, it was in the last mile of the end of the race, and kind of did that. And I finished, and I was so filled with so much and adrenaline. I think that I really didn't think twice about it. I mean, it was sore, and it definitely significantly slowed me down. But after the race, I couldn't believe I finished it, and my whole body was sore, so I really didn't think twice about it.
Yeah. When exactly, if you can give me a number of days, would it have been?
It was about last week to the day is when I
For the day,
finished
so
it.
last Tuesday.
Yeah, yeah.
Okay. So 7 days out. Have you been doing anything for it since then? Ibuprofen, well, medicine, to help with the pain, icing, compression.
I've been doing ice, and kind of just putting it up kind of makes it feel better. My pain, it kind of decreases my pain a little bit. Um, it's good. It's getting a lot worse, not to the point like I can't walk without feeling pain. I'm having a lot of issues sleeping. I can't get comfortable, can't sleep throughout the night. And with the whole stomach ulcers things, I'm kind of hesitant to take any kind of anti-inflammatory or
That makes sense.
ibuprofen or anything like that because my doctor said that it could affect my stomach, and so I just choose not to take any pain medicine for it.
No, and that's okay. Do you feel like the ice has helped manage that pain at all, or?
Just while it's on there,
Yeah.
after because I put it on for about 20 minutes, and then I take it off, and after that 20-minute waiting period of it being off, it kind of just comes back and gradually gets worse. And then it gets worse kind of like as I get up and try to walk around.
Hmm.
Um, can't really run. I've tried to run and jog for my recoveries. I can't do that whatsoever, which is really frustrating
Yeah.
because I really need to keep myself recovering, and feel like I'm losing a lot of strength just doing nothing. And when I'm walking around, I kind of have like this like limp, that kind of tenders to the left side.
Yep. Yep. Now you said that you kind of felt a pull, as you put it,
Mhm.
in the back of your knee and in the inside of your knee as well.
Mm.
Is there, let's see here. When you first did it, you said you felt a pull. Did you hear a pop or anything like that?
Not that I didn't feel or hear anything pop that I can think of. The back of my leg doesn't hurt anymore. It's just all on the inside now.
All on the
Um,
inside now.
yeah,
Okay.
it hurts when I'm like walking up and down steps. And coming down is probably the worst.
Hmm. Okay. Now, so walking up and down steps is making it worse. General walking. It's really hard for you to do any of your recovery runs and stuff like that.
Mhm.
Where exactly, if you had to kind of pinpoint your pain, where exactly would it be at?
I would have to say it's like um definitely like right inside my it feels like it's inside my knee, like
Uh-huh.
right in the middle.
Right in the middle, inside.
Yeah.
Okay. So I'm gonna kind of show you a couple of things on my own knee. Um,
Okay.
and if you can follow along on your own knee, if possible. So I just kind of want to like have you kind of feel around your knee, okay?
Do I
So
bend my knee like you?
yeah, so let's have you put is your knee, because you're sitting right now, so it'd be about 90 degrees. Um,
Okay. Yeah, this
so
kind of hurts. It kind of hurts at 90.
yeah, it kind of hurts at 90.
Yeah,
Um,
I kind of want to keep it out a little bit.
okay, well,
It
let's,
causes me pain if I go past a certain point.
okay. How far, like once you get to what kind of a point, is there any way you could show me, how
Yeah.
far you can get without going to pain?
Yeah. Hold on one second.
Sorry, I know it's kind of hard in an office, right?
Yeah. I kind of. So I don't know if you can see, but that's about as far as I can do it. If I come any closer, like about right there,
That
that's
definitely
where,
hurts.
yeah, that's where I mean it's not terrible, but like it starts to get a little bit more uncomfortable there, and I don't want to go anywhere past that. I mean, I can if I need to, but it's
Okay.
just sore.
Yeah, no, that makes total sense. Okay, in that case, I'm not going to force you to 90. I know that that's painful, and I don't want to put you through pain, especially with me not being there. I don't want you to overdo it and possibly hurt yourself more. We definitely don't want that. And I know that you're wanting to get back as quickly as possible. So that's definitely not on our agenda today.
Yeah.
Um, so walking up and down stairs, are there any other activities that you feel like really are inhibited by this injury?
Um. Well, I know I'm really concerned about getting back into coaching with my team. I really like to train with my team.
Okay.
I feel like running with them really helps, and cross country starts here in
Okay.
about the next 6 weeks or so. So I'd really like to get back. I know I'm not going to be able to really do too much right now where I'm at, and then I also have a dog that's kind of been sitting around the house doing nothing. I have a husky, and
Oh,
I
wow.
have to walk it every day, and she likes to go for runs with me, and I kind of can't do that anymore because my knee is just in that much pain.
Yeah. Well, and I understand that. I had a husky growing up, and I know the kind of energy that they have. So
Yeah,
that's definitely that makes it a little bit harder when you know that they want to get out and run.
yeah. I just kind of open the door, let her run. She comes back in.
Yeah. um, so let's see here. So it makes it harder. So up and down stairs, you'd like to be able to train with your cross country team. Take the dog for runs, stuff like that.
Mm-hmm.
So let's kind of go through a couple of different tests. So if you could stand up for me,
Okay.
and let's have you. There we go. Is there any way that you can? Let's have you shift your weight from right to left and left to right. How's that feel? Pretty
It hurts a
painful.
lot as I put all my body weight on my left side. It really hurts a lot.
Okay. Now, okay, you can stop. So, is there any chance? I'd like you to, and I'll do this with you. I'll show you how to do it. So I'm going to have you, if you could support yourself on your counter, okay, or somewhere,
Yeah.
or a chair or something like that, and then I'm going to have you put it on because it's on your left side. So let's have you put the chair on your left side if possible,
Okay.
just to kind of support yourself,
Okay.
and kind of lean on that chair a little bit, and go
Okay.
on your left leg.
Okay.
And can you twist at all? Oh,
I
okay.
mean, like I can, I could. It's just a lot of pain.
There's a
Like,
lot of pain. Yep.
yeah, it's just a lot of pain. If I turn to the inside, it hurts a lot.
Okay.
Yeah.
Do you feel you're good? You can sit down now.
Okay.
Do you feel any popping, clicking, anything like that when you do that?
No, there's no popping, no clicking,
Okay.
or anything like that.
Okay. Do you feel like your knee is unstable at all?
Yeah, especially when I'm coming down the steps. That's kind of when I have the most. Like I'm kind of like if I have that left leg, I really have to hold on because the one time I tried to come down and it felt like my leg was getting ready to go out and do that kind of like the same thing it did um, during the race.
Okay. How's the swelling been?
It's pretty swollen. Like I think that's where I kind of where it's kind of I've gotten concerned of when to call it because the swelling hasn't gotten any better even with the ice and
Hmm.
keeping it up. It just keeps getting bigger and bigger on the inside.
Okay. And is there one specific spot that's more swollen than the others, or is it just all around your knee?
Kind of like where my kneecap is to the right of my kneecap. It's kind of like really swollen in there, and it's starting like it's starting to move across the whole entire knee.
Okay. Starting to move across the entire knee. So,
I think it's just from like the swelling like building up or whatever because it's like in the back of the knee too.
yeah. Okay. So it's in the back of the knee. So, since it's your left knee, I'll show you my left knee. So you say your swelling is kind of in this area of your knee.
I would say more on the inside part of my knee. So
So on this side.
yeah, and then as you get closer towards the like middle of the knee, kind of like where like the knee comes together.
Yep. So kind of like all in this area.
I would say even more closer to the middle
Okay.
or inside, more to the inside and a little bit higher up on the leg.
Okay.
Yeah, I'd say more in there. That's kind of like where all the swelling is building up the most.
Yep.
That's where it hurts a lot to push right there too.
Okay. Yep. That makes sense. Okay. Cool. Um, so let's see here. All right. So I just kind of want to recap everything.
Mhm.
Just make sure I have all the information from you. So you were doing a full Ironman. You got through the swim and the bike, and you were in the last half mile of your run.
Mhm.
And you sounds like you slipped on a cup that somebody left on the runway.
Yeah.
You said your left foot kind of slid, um, and then you felt a pull in the back and on the inside of the knee when you came down on it. Correct?
Yeah. Yeah. My knee like went in. Yeah.
Yep. You didn't hear a pop, but you did feel a pull.
Mhm.
This happened about a week ago. You've been icing and elevating, but the pain and the swelling is just getting worse.
Mhm.
And you're not taking any meds just because you have had those stomach ulcers and your doctor recommended that you don't, which is really good on you.
Yeah, he
Um,
didn't recommend that I don't. He said just be careful. So I just kind of chose that I don't want to do it at all.
no, that makes sense. And that's definitely something that would be a question for a physician, especially if he's been treating you for those before taking meds. Um, so, you've got pinpoint pain on the inside of your knee.
Mhm.
You're having trouble putting any weight on it, going up and down stairs, and you're not able to do any of your recovery runs or anything like that. Sound about right?
Yeah. Yeah.
Okay. So what this might sound like, without being able to do any physical tests, it sounds like you might have a um, a mild to moderate MCL sprain. So the MCL or possible meniscus. Um, it's kind of hard to tell without me being there in person. To be honest with you, I think so. If you're feeling, and I kind of want to show you this one more thing I feel like I may have missed. So when you're feeling along that knee, you can kind of feel that joint line. Does it feel like your pain is more inside of that joint line, or does it feel right over kind of that connection on the inside of your knee?
Kind of feel it's definitely like it's kind of hard to feel with all this. It's really sore.
Swelling,
Like
yeah.
right, like I wouldn't say on the bones, but like kind of like in between the bones. There's like I could feel like all the fluid, and then I kind of run my fingers over, and the pain like gets a lot worse. I guess kind of where you're talking about where the bones come together,
Hmm.
but it's more on the kind of like right in the middle of all of that. Like I push right in the middle, and I get down closer to the bone, and it's sore down there.
Okay.
But the pain's more localized, like right in the middle as it comes down.
So right in the middle. So when you're saying like right in the middle, you're saying like right here in the middle of the joint or in the middle.
Yeah, yeah, middle of the joint, I guess. Yeah,
Okay.
and then kind of as it comes down to the lower part of the bone.
Okay. So as it comes kind of down into this direction.
Yeah, like once you get down to the bone, I can kind of feel it, but then when I come up right to the middle, that's kind of where it's isolated the most. That's the most pain right there. Yeah.
Okay. Perfect. So I really think that you may have, you might have a possible MCL sprain,
Okay.
mild, very moderate. But it's something that I would definitely go in to see a physician about. Um,
Okay.
I would recommend, without me being able to do the physical tests, it's really hard to be able to tell 100%, exactly what happened. Um, just to double check, you said you don't have any pain in the back of your knee anymore, correct?
No, not really. I mean, it pulled back there, but it's not there anymore. It's definitely more on like on that outside inside part of the knee.
Inside part of that knee. Okay.
Yeah.
Yep. So it sounds like you might just have a mild or moderate MCL sprain.
Okay.
Um, I would definitely get into a physician just to have them double check it. They might want to do some imaging just to make sure that you don't have any, tears in the,
Okay.
which is always a good idea. The nice thing about the MCL is it's a very, um, it's a lot easier to heal on its own, especially with like rest and correct exercises and things like that. Um, it's just it's probably the less significant tear in the knee that's possible. Does that make sense?
Yeah. So does that mean I can go and run with my team here in 6 weeks? So I have no problems whatsoever. I can
I
run
think the
and
biggest thing is we need to
kind of like my
schedule.
sprained ankle.
let's make some goals together. And I think that we could attempt to, I wouldn't say you're going to be able to do a full run. I'll be honest with you. But I think you could start training with them at that point.
But
Um,
I really need to be with them here in the next 6 weeks to really train. That's the only way I can really reach them since they're a lot younger. It's hard for me to connect with them. So I kind of really running with them helps me keep up with them a lot.
And it kind of gives
But
you that opportunity to get to know them, and they open up when they're running and stuff
yeah,
like that. Yeah, that
yeah.
makes a lot of sense. Um, like I said, the knee, especially the MCL, it heals quickly, and every person is different. I think what we should do is we should set a goal. And that goal will be that you can start training with your team in 6 weeks. But
Okay.
you take the appropriate steps to be able to reach that. The other thing I would recommend is going to see a physician just to make sure that there's no other underlying issues within the
Okay.
knee. They might want to, like I said, they might want to do some imaging. But I think the first thing that we could talk about, of course, is just some goals for you. Um,
Okay.
I know that, 6 weeks out, you really want to start training with your team. But I think one of the big things in order to hit that goal, because that could be our end goal, I think one of the big things is making steps, like getting some steps, getting, daily activities and things like that are really going to help you reach that goal. So what are some things that you're doing in your everyday life that have been inhibited that you would like to be able to accomplish, say by next week, by next Tuesday?
I would definitely say like taking my dog out for a walk or a jog or something because I could tell she's really she feels kind of neglected. So I really want to be able to take her out for a walk
Okay.
without me having any pain or issues stopping me from that.
Okay. So that's one. Let's go with one more. What's one more goal that you would like to be able to accomplish, say by next Tuesday?
I really like to be able to walk up the steps without any issue, without any pain.
Okay. On a scale of like 0 to 10, 10 being the worst pain you've ever experienced, 0 being, just sitting here talking, not doing anything, not in any pain. When you're going up and down the stairs, how severe is that pain?
I'd say it's about an 8 out of 10.
8 out of 10. Okay.
Yeah.
And how about when we're just sitting here? How does it feel?
So just sitting here, I'd say probably closer to like a 2 or 3.
Okay, cool. So 8 out of 10 that's a pretty significant pain. I think that's something we could shoot for by next week. And I know that you want to be totally pain free, but again, it'll be a process. What if we shoot for being at a 4 out of 10 when going up and downstairs?
Okay, I'd really like to get lower, but I think we can start at a 4.
You know what? If we can get you lower, let's do it. But like I said, we're gonna have 6 weeks of goals, and every week we're gonna hit those goals. Like that's the plan. We're gonna hit those goals. We're gonna get you better.
Okay.
Um, so let's set our goal for 4. And if you wanna do more than that, like if you want to be able to try to get to a more pain-free, ability to go up and down the stairs, then I think that we could definitely keep working our goals towards that.
Okay.
So 2 goals for next week that I would really like us to focus on are going to be taking the dog for a walk and walking up and down the stairs, limiting that pain.
Okay.
I would like to also make a goal of going to see a physician. Do you, I know that this is kind of a weird question, but it's one that I kind of like to ask so I can make referrals. Do you have insurance to be able to go see a physician?
Yeah, I have insurance through the university.
Okay, perfect. So that going to see a physician shouldn't be too hard.
Okay.
Um,
Okay.
so I would recommend, let's make it a goal that by next Tuesday you've seen a physician.
Okay.
And I would also ask them if there's any alternatives in medication that you could take that wouldn't affect, your past history with ulcers.
Okay.
That would definitely be a good thing for you to ask them as well,
Okay.
talking to
So
them.
I can just go to like Med Express because I feel like that would be the fastest way to get in and out, right?
Well, so you could go to Med Express, but the problem is a lot of those Med Express people, they're trying to get you in and out as quickly as possible, and sometimes they don't do a thorough enough exam, or they just think that, let's get you in, get you done, get you out. I would recommend going and seeing maybe an orthopedic specialist.
Oh, okay.
We have one that's here local. His name's Dr. Hagan. I would definitely, look into going and seeing him. If you would like, I can make a couple of phone calls if you want to let me know what insurance you go through, and I can see if they accept your insurance, and I can let you know by this afternoon.
Okay,
Um,
yeah, I'm in South Florida, so I don't think I'll be able to get to Indiana.
okay. Let me talk to our local orthopedic, Dr. Hagen, and I can see if there's anybody down there that he would recommend, or is there anybody that you would prefer to go see?
No, I think I'll try to see if you could help me out. I'd appreciate that.
Yep.
Figure out who's the best in the area to go to.
Yep. I'll talk to Dr. Hagen today. He's very easy to get a hold of. I got him on speed dial. So I'll give him a call and see if there's anybody down there that he would recommend or anybody he knows that I could call. And we'll get you into a good orthopedic specialist just to get you taken care of.
Great.
And so I would like to do that. So we'll have our goals would be take the dog for a walk up the stairs, limiting that pain. And we're going to see a doctor and talk to him about your knee, possible imaging, and any medications that you could take for pain that wouldn't affect your ulcers. To be 100% honest with you, I'm not totally sure about the medications. Pharmacology is not my strong suit personally. So that would definitely be a physician question.
Okay.
So as of right now, those are just a couple of the different things that I would like to, start with. And then what I think we could also start with is some basic exercises.
Okay.
So what I can do is I can put together an exercise plan for you that will focus on starting to get that range of motion back and some exercises and things that will kind of try to help flush some of that swelling out of your knee. And hopefully through that, we can start seeing those range of motion gains, and we can start seeing, the pain decrease and the swelling decrease.
Okay.
So like I said, a couple of things, they're going to be very simple. They're going to be just range of motion exercises. And so what I'll do is I'll put those on a sheet and I can email them to you. It'll have a picture. It will have a full description of the exercise, and the sets and reps that I would like you to do. And if you can just do them once a day, that should definitely be a good start for us. And if you do have any questions, don't hesitate to call. But also with the sheet that I'm going to send you, there will be a tag at the top of it that you can go to a website and put in your tag, and it will actually show you videos of how to perform those exercises.
Okay, great.
So it's pretty cool. It's awesome, and it really helps. But again, if you do have questions, concerns, or anything like that, don't hesitate to call when doing those exercises. I'm always available. But as of right now, those are kind of some of the things that we're going to approach. And do you have any questions for me?
No, yeah. So my buddy, he hurt his leg the other day, and they gave him a TENS unit, the athletic trainers at the school. Can I just steal his TENS unit and use that?
Um,
It really helps with his pain, so I was thinking I could just borrow it from him and use that.
So before we start with that, I think I would really like to focus on seeing if we can limit your pain through the range of motion exercises, and through just the trying to get the swelling out of your knee, and seeing a physician first.
Okay.
And then
So don't use it?
nope, I wouldn't use it yet. And then we
Okay.
can approach it from there.
Okay, sounds
I
good.
think the biggest thing for us right now is let's get rid of that. Let's get rid of the swelling. And we're going to keep icing. If you could ice it every day, especially after you do any type of physical activity, after you've been walking or anything like that, it's always a good idea to ice that. Just make sure that the ice, if you're using an ice bag, that's okay. Put it up against your skin, but only leave it on for 20 minutes. If you use a cold pack, one of those ones that you pop, put a towel or a shirt or something over your knee and then put it on there. Cause otherwise those actually get so cold that they can cause ice burns.
Okay.
So just be careful with those.
Okay, I think I'm just gonna get
always,
ice from the trainers.
yeah, perfect. I would always recommend doing that rather than using an ice pack.
Okay, sounds good.
Do you have any other questions?
No, that's it. Thanks for helping me out, and I'll be sure to get in touch with a doctor here soon.
Awesome. All right. Like I said, Jordan, if you have any questions, feel free to give me a call, and I will try to get a hold of you this afternoon to give you some advice on who you could go and see.
Sounds good. I appreciate it. Looking forward to it.
All right. Thanks, Jordan.
Thanks.